The deadlift, the infamous king of exercises. Some say it'll turn you into a monster, that is, if it doesn't snap your back first. Lastly, it's been getting a lot of flack from not only the general population but the lifting community as well, such as when professional strongman competitor Robert Oberst came on Joe Rogan's podcast and said that he would not recommend deadlifts for anyone who doesn't need to do them for competitive purposes. Why would he say this? Whether it's right or wrong, every exercise enthusiast needs to be informed, or the deadlift could end up dead in the water. Before we go any further, we need to make it clear as to which deadlift we're referring to. There are a plethora of variations, but there's only one that needs no qualifier. The deadlift refers to the conventional deadlift. The conventional deadlift is performed with a hip-width stance and hips pushed back significantly. This flexes the hips, thus allowing the torso to drop and grab the barbell, shoulder-width apart. Then from a dead stop, you pull the bar up off the ground all the way until your body is fully extended. We'll go over it in more detail, but that's the gist. Due to its rawness, it's generally considered the hardest and toughest exercise there is. Ironically, it's also the exercise that allows you to lift the most weight. In addition, it's one of the few competitive lifts. Together with the bench press and the back squat, it's one of the 3 key exercises in powerlifting. Needless to say, thanks to all this, it's also one of the most famous exercises there is. At the same time, it's one of the most technical exercises and can take months to perform safely enough to start loading with progressively heavier weights. So what are the pros and cons here? Let's first look at why it's so hard. One major reason the deadlift is so difficult is that it starts with the concentric contraction. This means it doesn't get to benefit from the stretch shortening cycle or SSC. The SSC is a phenomenon that results in extra power. Your tendons and ligaments are stiff yet flexible and are able to store energy during the eccentric portion of a movement as they stretch, similar to a rubber band. When you transition into the concentric contraction quickly, the energy is released, aiding in moving more weight. SSC is why you automatically draw back before you throw a punch for extra power. Unfortunately, you get no such help with the deadlift, which differs from most exercises, especially using the large amount of weight it does. Now let's go through the movement and see what's going on. The setup is vital for optimal performance of the deadlift. Many people use a foot placement that's too wide. The easiest way to locate the perfect width is to jump vertically as high as you can and see where your feet naturally land. For most people, this is simply hip width apart, as this is where you're able to direct force straight down into the ground. From there, stand so the barbell is over the midfoot, which is generally an inch or so in front of the shin. Next, bend over and grab the bar with a shoulder-width grip. This will be outside your legs. Then you'll push your hips back and sit while allowing your knees to bend slightly. This bend will cause your shins to move forward and touch the bar. From here, you lift your chest up and straighten your lower back. One of the first cues to look for is your shin angle. There will be a slight angle, but it shouldn't be dramatic. It should be closer to vertical than not. This would allow the bar to travel straight upwards rather than go around the knees if they were forward. Because you only have a slight bend in your knees, your quadriceps aren't used to the same degree as other exercises, such as the back squat. In a back squat, your knees will come forward, which ultimately closes the angle in the knee joint, creating a greater range of motion that requires more knee extension. This is exactly what was found in a study that compared the back squat to the deadlift, with the deadlift experiencing significantly greater movement and work in the hip extensors, while the back squat saw more in the knee extensors. However, this doesn't mean that there's no activation in your extensors. In fact, your extensors are one of the primary muscles to get the bar off the ground, as it must push the floor away, one of our favorite deadlift cues. This was shown in a study comparing the conventional deadlift to the Romanian deadlift, where the conventional had more activation in the quadriceps. Keep in mind that when compared to the Romanian deadlift, there's more flexion in the knees as the bar must travel further down. A study that examined EMGs of muscles during the deadlift verifies this, as the quadricep muscles were more active while the knee was extending at levels of greater flexion at the beginning of the deadlift. As the knees extended more throughout the movement, the activity in the quadriceps lowered. The exact opposite happens in your hamstrings. As you rise and bring the bar to knee level, your hip flexion doesn't change too much. Rather, your posterior muscles flex in more of an isometric fashion and hold the position to keep your shoulders over the bar. Therefore, your hamstrings are at their lowest levels at takeoff and gradually rise as you ascend. We should note that we're saying their lowest levels, not low levels. In other words, all your muscles have high activation throughout the movement. It's just some places are lower and some are higher. When looking at the upper back, primarily the trapezius muscles, they follow a similar path as the hamstrings. They're at their lowest levels during the beginning of the lift and increase dramatically as the lifter ascends, tending to peak at knee level. Due to the high activation in the back during the latter part of the movement, lifters will utilize what's called a rack pull to train their backs. A rack pull or a block pull are variations where the bar is set so the bar stands around knee level. When it comes to the lower back and lumbar spine, the conventional deadlift does tend to be the most taxing, especially when using heavier weights. This is caused by the load being on a longer moment arm away from the hips. This essentially creates more torque, which places greater stress on the lower back. Regardless, your core muscles are under extreme stress throughout the movement as a means to keep the torso stable and protect the spine. This has made the trap bar deadlift attractive to coaches lately. We'll discuss why later in the video. One part where the deadlift differs from most other exercises is the lack of an eccentric contraction due to the funky biomechanics of lowering the bar safely. Rather, lifters tend to use a controlled drop to safely lower the barbell. All in all, the deadlift will stress just about every muscle in the body due to its rawness. But it isn't just the muscles that are impacted by the raw power of the deadlift, when done correctly. Did you know your bones can actually grow in size and strength just like your muscles? When excessive stress is placed on a bone, it'll bend slightly, creating tiny little fractures. Those little fractures are then filled in with what are called osteoblasts, which then form new bone. This is what happens to college-aged men and women after 24 weeks of resistance training. While the participants utilized a whole-body training program, the squat and the deadlift were specifically chosen to drive bone growth. After training, it was found that participants' bone mineral density increased on average by 1% at any given site. However, the average bone growth in men was greater and occurred anywhere from 2.7 to 7.7%. In women, the range was lower, at negative 0.8 to 1.5%. Now let's talk about every new lifter's most pressing question. Do deadlifts wreck your back? Yes, you can get injured performing deadlifts, but it's probably not as bad as you think. Overall, weightlifting has a rate of injury of 1 to 2 injuries per athlete per year and 2 to 4 injuries per 1,000 hours of training exposure. Compare this to male soccer players' experience at a rate of 8.1 per every 1,000 hours. When it comes to the type of exercises that cause injury, deadlifts are overrepresented, but they tend to differ by type of training. For example, it's one of the top 3 injuries for powerlifters, but not seen in the top injuries for bodybuilders. There's a very clear association between serious deadlift injuries and those who use heavier loads. Now, while we always want to hear about the dangers of deadlifting, we rarely hear the flip side. It actually helps protect the body. As we mentioned earlier, the deadlift is a powerful exercise to train your posterior chain. This not only includes building a strong, powerful core, but it also improves the functionality of these posterior muscles. At the same time, it can actually reduce the pain in your lower back. A review examined the available literature on deadlifts being used in therapy programs for lower back pain. Deadlifts were found to decrease pain, improve function, and increase quality of life in patients with lower back pain. For example, one of the studies reviewed saw a 72% improvement in pain, a 76% improvement in disability, and a 27% improvement in quality of life. That is pretty amazing. So let's talk equipment. Wrist straps are often associated with a deadlift. Why is that? Essentially, using wrist straps heavily mitigates the amount of force your grip must produce to hold the bar by attaching the load to your wrists. This is critical as everyone gets to a point where their deadlift performance is limited by their grip strength. With straps, you can simply worry about lifting as much weight as possible as your grip is taken out of the equation. This is estimated to be about 20 to 30% more than without straps. This much load places a significant amount of more work on all your muscles, minus the forearms. Another interesting variable is that wearing straps increases time under tension, or TUT. TUT refers to the amount of time a muscle is actually working and how long a rep takes you. It's been found to be a significant factor in improving both strength and muscle growth. As the wrist straps allowed a heavier load, the reps actually take longer to complete. So not only are you able to lift heavier loads, straps can increase TUT, thus magnifying the amount of fatigue and stress placed on the body. Sure, some people abuse straps, using them to cover for poor grip. However, when used strategically, they're able to significantly improve your deadlift, thus adding muscle and strength. One thing we know for sure is that the deadlift generates more fatigue. Well, actually, maybe not. This is something that caught us off guard. The deadlift is notorious for being draining. After a good deadlift session, it's fair to say it feels like you've been hit by a truck. When speaking about fatigue, there are two types: central fatigue and peripheral fatigue. Central fatigue is fatigue that tires the central nervous system, or the CNS. This is the fatigue that makes you feel mentally exhausted. It may even present itself with strength loss, yet no soreness. Peripheral fatigue is physical fatigue. This is when mentally you feel fine and have normal levels of energy, however your muscles are tired or even sore. Like when stairs become a torture device after leg day. Well, a study from 2019 put the squat up against the deadlift and had participants lift 95% of their 1 rep max for 2 reps. Your 1 RM is the maximum amount of weight you can lift for 1 repetition. Therefore, 95% 1 RM is very close to your max. Fatigue levels were measured, and they found that central fatigue was the same for both exercises, while peripheral fatigue was greater in the squat. Another study from 2019 compared the fatigue levels of the squat, bench press, and deadlift when training 4 sets to failure using 80% of 1 rep max. That is, they performed as many reps as they could. They then measured numerous variables including limb swelling, joint range of motion, delayed onset muscle soreness, average concentric velocity (ACV) at 70% of 1 rep max, creatine kinase, lactate dehydrogenase, and cell-free DNA or cfDNA. Even with all the variables, the deadlift did not present a greater amount of muscle damage or need for longer recovery time. This may be due to there being a lack of an eccentric phase, as it's known to cause a greater amount of muscle damage. It may also have something to do with the effort when not in a laboratory setting. Generally speaking, people will try harder with the deadlift. Lifters are much more likely to push themselves past their limit, as nothing happens if a lift is missed, assuming there's no injury. Lifters are more likely to push farther. Compare that to a bench or squat, where the load is directly over your body. You may not be so keen to do another set with added weight, with that much weight over you that can pin you down if you fail to lift the weight. One other reason may be due to using volume training. Perhaps things are different when training for max lifts. Regardless, this tells us that if you follow a structured program and actually follow it, not go off and try to set new PRs every session, you know who you are, you shouldn't have to worry about being beat the next day. So, the majority of this video has been referring to the conventional deadlift. However, many of you are probably interested in the other deadlift, the legendary sumo deadlift. If you're not as familiar with the sumo deadlift, aka sumo, here's a quick description. The sumo gets its name as it resembles the ready stance of a sumo wrestler. You know, where you bend down in an ultra-wide stance with the torso straight up and clap your hands. In fact, that's actually a really good description of the sumo, minus the whole hand clapping. Unlike the deadlift, which has a relatively narrow stance, the stance of sumo is ultra-wide. It's excessive. While there are various factors that determine the proper width, it's generally around 1.5 to 2 times your hip width. Your legs are then externally rotated so your toes are pointing outward. As your stance is so wide, you'll grab the bar with your hands straight down between your legs. Since your legs are rotated externally, your hips won't be pushed back as far from the body as you sit back. Rather, they come down closer to your legs. Also, to be able to grab the bar, you must also bring your hips lower as the torso is more upright. As a result, the hips need significantly greater mobility to perform sumo deadlifts. As the hips are closer to the body, the torso is significantly more upright to keep your arms over the barbell. The degree will depend on the person's measurements, but it's not uncommon to see some lifters with an almost totally vertical torso. And it's here where we see the major differences between sumo and conventional. The upright torso means less flexion in the hips, which mitigates the involvement of the hamstrings and places a greater percentage on the quads. For this reason, although it is still called the sumo deadlift, it's actually quite different from the conventional deadlift as it's quadricep dominant. You may have heard sumo get a lot of flack from a certain group of lifters, things like being called a fake deadlift or a cheat variation. This refers to the smaller amount of distance the bar travels as the legs are spread so wide, thus shortening the height at lockout. While we don't think it's a cheat version, there is some truth to that claim. A 3-dimensional kinetic analysis of sumo and conventional style deadlifts found the bar travels 20 to 25% farther during the conventional pull, which results in 25 to 30% less mechanical work in the sumo. However, when looking at the two lifts, the conventional tends to be the heavier one out of the two. Therefore, neither is easier or harder, it just depends on the biomechanics of the individual. One plus of the sumo is the torso is vertical, placing less stress on the spine. This makes it an attractive option for those with injured backs. But that's not all. Let's hop into a quick lightning round of other variations. The deficit deadlift is performed by standing on a short object, usually 2 to 4 inches high, which increases the distance the bar needs to travel. This also greatly increases knee flexion, which requires a much greater amount of activation and work from the quadriceps. Performance-wise, they're great for those with trouble getting the load off the ground. Romanian deadlift isn't actually a deadlift, as it starts with the eccentric contraction, and the load never touches the ground. Anyhow, it's an awesome accessory to any program. The Romanian deadlift targets the posterior muscles while mitigating the use of the quads, making it great to isolate the hamstrings and the glutes. We spoke of the trap bar deadlift earlier in the video, and here we are now. In a trap bar deadlift, the lifter stands in the middle of a hexagonal-shaped bar and holds onto handles out to their sides. This places the force directly in line with the legs, allowing true vertical displacement, which also allows a more vertical torso, mitigating more stress on the lower back. There's also another advantage. No bar in front of the shins allows a lifter to modify their stance to target different muscles. It lets the knees come forward to hit the quads or keep them back, similar to a conventional deadlift, to target the hamstrings. And of course, here's what you've all been waiting for. Here's how to most effectively use the deadlift. As it's the heaviest movement you can do, it should always be the first exercise of the day. This is especially true for the deadlift, as you don't want to be fatigued when you start training it to keep good form. We see the deadlift as being a pure strength movement, so you should generally use heavier loads, 85% of your 1-rep max, with fewer reps, less than 6. Remember, execution is technical, so doing too many reps can build fatigue, increasing your chance of injury. On top of that, be sure to take a little pause between each rep. A good setup is vital for safe performance, so you should take the time to make the needed adjustments between each rep. Moving too fast through a set can throw your body out of position and increase your chance of injury. Before you actually begin each rep, you want to get the slack out of the bar. This refers to removing any in the bar and pulling it tight as it catches the weight. Pull this slack out and get your body tight. Getting your body tight properly starts with pulling up against the weight of the bar. You're not pulling the weight off the ground just yet, but allowing the weight to let you pull up the bar. Now, you'll get your shoulders back to keep a straight back. This should get your legs, back, and arms tight. Then you'll brace your core by performing what's known as the Valsalva maneuver. The Valsalva maneuver is where you close your airway out and exhale out. This will increase your intra-abdominal pressure. This creates a stronger core to protect your spine. Start each rep smoothly. Don't try to jerk the load off the ground. Think if you had a rope tied to a tree and yourself, and you start sprinting away, you're going to get snapped back when the line catches. Same thing here. So again, get the slack out and pull firm but smoothly. As you begin each rep, think about pushing the floor away rather than pulling the bar up. This causes the lifter to utilize your quadriceps to a greater degree. At the same time, lifters tend to keep their back pulled back more. As you descend, don't bounce the weight. That refers to dropping the weight quickly onto the ground, which causes the weight to bounce off the ground, making a succession of reps easier. Again, this can increase the chance of injury while taking out work, which defeats the point of the deadlift. Some athletes will use a bounce in a competition as they're trying to get more reps to win, but this is completely different from the goals of training. The conventional deadlift is an amazing exercise. The deadlift variations are amazing exercises. The deadlift is simply amazing. Much of the bad rap it's received is due to improper technique or progression. If trained properly in a structured program, the deadlift will be the most powerful exercise in your arsenal. Not to mention, it's actually going to make you injury-proof by building a strong, formidable core. And if you are injured or have mobility issues or special needs, there's a variation to meet your needs. While you don't have to perform deadlifts, it could very well be the best if you've got the drive and dedication to master it. Now check out what happens when you're dying, or watch this video instead.